Meals on Wheels provides free food daily to thousands of people, especially the elderly, in Colorado and many other U.S. states.
We deliver love in the form of food and companionship.
Paid staffers and volunteers prepare and deliver the meals.
Hi, Betty.
In many cases, right to folks' front doors.
We really are a way of checking up on these people to make sure that they haven't fallen, that they haven't gotten hurt.
It's probably a relief to my family to know that somebody comes in and checks on me every day.
But this service is a little harder to come by these days.
The system has been impacted by COVID.
Jayla Sanchez-Warren runs the Denver-based Area Agency on Aging, which helps administer community-based services like nutrition, transportation, and in-home care to those in need. It's currently dealing with a severe lack of workers.
So many people left these professions. I lost half of my staff during COVID. It's been hard to replace those people.
The labor shortage in the U.S., which surfaced during the pandemic, has resulted in social service agencies being unable to compete effectively for employees in terms of pay.
Before COVID, drivers were being paid $15 an hour. Now they're being paid $21.50 an hour, and we still can't keep pace.
Besides taking other jobs or retiring, some of her employees have come down with COVID themselves.
We hear daily from people who needed a ride and a driver got sick with COVID, and so there's not enough capacity to serve those individuals. Right now we have about 1,200 people on a waiting list for some kind of service. That feels really stressful to me.
Some clients now get frozen food rather than fresh meals. Volunteers are taking on extra routes.
Incoming.
She says it's not a crisis yet, but eventually federal pandemic aid that her agency relies on will run out.
We want to be able to age well and with dignity and have choice. If we have community-based services, it's cheaper, it keeps people in their homes, and that's important.
One study indicates as many as 4 million Americans are currently out of work due to long COVID. The impact of this disease is being felt in various ways, including in this community.
Older adults matter, and we need to remember that.
Hendrik Sabrandi, CGTN, Denver.